So you've got plantar fasciitis, and you don't want it for two main reasons. Number one, it hurts. And number two, it sounds like you've got a planter full of fascists on your patio. And you don't want your neighbors to think you're running some sort of authoritarian vegetable garden. So today, I'm going to show you what actually works to get rid of that relentless heel pain. So we're going to cover plantar fasciitis in different sections. The first section will be on getting the diagnosis right. Now, I'll admit that sounds boring, but just because you have pain on the bottom of your foot doesn't mean that that's plantar fasciitis. And it's wildly important that you get the diagnosis right, because if you're treating the wrong condition, it is bound to fail. Number two, we're going to talk about arch height and pronation and how they relate to plantar fasciitis. Number three, we're going to cover things about how to actually get rid of the pain. So we're going to cover the things that work and things that are nothing more than snake oil, or in some cases, even worse than that. So we're going to cover things like orthotics, laser injections, steroid injections, PRP injections, shockwave, and others. And this won't be opinion-based. I'll show you the actual evidence of what has been shown to work and what is a waste of your time and money. So let's get started with talking about the diagnosis, because before we do anything, we have to make sure that you actually have plantar fasciitis, or as researchers now call it, plantar heel pain. And yes, I know how ridiculous that sounds. You go to a healthcare provider and you say, hey, I have pain on the plantar side of my heel. And they say, well, you have plantar heel pain. That's the diagnosis. Gee, thanks, doc. Now, why is it actually called plantar heel pain in the research literature? Because the pain in your heel could be coming from a variety of different structures. And if you're treating the wrong one, nothing is going to get it better. So here's what I mean. Sometimes it's the plantar fascia itself, but sometimes it's the medial calcaneal branch of the tibial nerve or other deep branches. It could be the small muscles under your foot, like the flexor digitorum brevis, quadratus plantae, flexor hallucis brevis. It could be the tendon of the tibialis posterior, which is a muscle in the calf, but its tendon inserts onto the bottom of the foot. So it could even be a bruised or thinned heel fat pad or bursa. It could be a stress fracture in the calcaneus. So that means the first step isn't stretching or taping or buying some gadget off the internet. It's getting the correct diagnosis. And this becomes really important when you go to a healthcare provider, because if you go to a healthcare provider and you point to the bottom of your foot and you say, hey, I have pain on the bottom of my foot, and they automatically say, well, yeah, you have plantar fasciitis, and they never actually touch your foot, or they don't actually do a physical exam to confirm that it's plantar fasciitis, I don't want to tell you what to do, but you should probably find another healthcare provider. So yes, as simple as this may seem, the correct diagnosis is the first step in managing the pain, because if you're doing the correct treatment on the wrong structure, you're going to end up being frustrated and it's not going to get better. And that's not your fault, it's your healthcare provider's fault. So let's move on to section 2, arch height and pronation myths. Because a lot of people, and honestly a lot of clinicians, still believe that plantar fasciitis comes from having flat feet or high arches or something called overpronation, right? The research, however, says otherwise. This 2020 review concluded current evidence linking arch height and foot alignment to plantar heel pain is equivocal. In other words, there's no link. In 2021, a study published in the prestigious journal Nature literally titled the study, Clinical Measures of Foot Posture and Ankle Joint Dorsiflexion Do Not Differ in Adults with and Without Plantar Heel Pain. Another study looked at more than 160 people and concluded there was no significant difference between excessive foot pronation between plantar heel pain and non-plantar heel pain groups. So you may come across studies that say something like, hey, pronation is associated with plantar heel pain. But remember, just because pronation is associated with, that doesn't mean that it's been shown to be a cause of developing plantar heel pain or plantar fasciitis. Association and cause, totally different things, right? For example, if you always see firefighters at a fire, does that mean that the firefighters caused the fire? No, of course not, right? But they're associated with fires. The same concept is true with pronation and plantar fasciitis. So what's the translation of all this? Well, arch height doesn't matter. Overpronation doesn't matter. It's never actually even been clearly defined. It's just an examiner's opinion. The real cause, almost always, of plantar heel pain is a load versus capacity problem. You asked your foot to do more than it was ready for. For example, maybe you started wearing flip-flops all summer when your feet weren't ready for it. Maybe you suddenly increased your running mileage. Maybe you started a new job that had you standing all day. Those are all examples where the load exceeds the capacity of the tissue. On the other hand, maybe your capacity is low because other factors like stress, systemic inflammation, higher fat mass, other things like that, reduce the capacity of the tissue and increase inflammation in the body. In fact, a big review found people with more fat mass get plantar heel pain more often, not just because of the weight alone, but because of fat tissue releases inflammatory chemicals that can sensitize tissues. So stop blaming the pain on your anatomy, right? You've had this anatomy your whole life and your feet were fine. It's not your anatomy's fault. It's just that the load that you applied exceeded the capacity of the structures in the feet and they're upset about it. Simple. Okay, so now let's move on to what you can actually do to get rid of plantar heel pain. Let's start with orthoses. Yes, orthotics can help some people, but not most. However, if they do help, it's not because they're like fixing something. They're just redistributing the pressure to other areas so that there's less load on the painful spot where the plantar fascia attaches. So you can think of it like maybe placing a pillow between you and an uncomfortable chair. The chair hasn't changed, you've just shifted the pressure, and because of that, the evidence is really clear. Orthotics can help in the short term, but not the long term. So there's no reason to use orthotics forever. If you decide to remove your orthotics, you need to do it very gradually over months, because if you do it too quickly, your feet have gotten used to the orthotics and you may simply get pain because you changed too quickly. And so the last point I want to make about orthotics is that studies are very clear on this. An over-the-counter orthotic that you can get for 50 or 60 bucks is just as effective as a custom molded one that you can get from a healthcare provider that costs $500 or $600. So don't get coerced into spending all that money for something that's just as effective as something that's literally 1/10 the price. Okay, so let's talk about shockwave. Shockwave is a treatment that has been used for plantar fasciitis for a long time. And this is the treatment with the strongest evidence behind it. Extracorporeal shockwave treatment, or ESWT. Shockwave treatment is a non-invasive treatment that uses high-energy acoustic waves delivered through the skin to the painful areas. And those pressure waves stimulate blood flow, they trigger tissue repair, and they help break up disorganized scar tissue in the plantar fascia. You can think of it kind of like shaking up the area at a cellular level to restart the healing process without needles, surgery, or medication. And this is not voodoo. Multiple high-quality studies and meta-analysis show that it works. For example, this large meta-analysis looked at 19 different studies and it included over 1,600 patients, and they compared laser therapy, pulsed radiofrequency, ultrasound, shockwave. And they concluded only radial shockwave therapy induced significant pain reduction compared with placebo at 0 to 6 weeks. And if you look into shockwave, you're going to find that there's basically two different types, radial and focused. And this paper found radial extracorporeal shockwave therapy is advantageous over focused extracorporeal shockwave therapy. So radial seems to be better than focused for plantar fasciitis. The biggest study to date was this huge meta-analysis where they looked at 236 different studies totaling over 15,000 patients. And they looked at studies that included Botox injections, strengthening, steroid injections, dry needling, athletic taping, low-level therapy, myofascial release, something called PRP or platelet-rich plasma, which unfortunately is being promoted a lot, radiofrequency, stretching, and shockwave. And only shockwave showed consistent medium and long-term benefits for plantar fasciitis. And the authors concluded in the medium and long term, only extracorporeal shockwave therapy was effective for improving pain when compared to the control. Now, lastly, this study looked at 16 different studies totaling more than 1,000 patients and found shockwave outperformed corticosteroid injections at 3 and 6 months for pain, fascia thickness, and foot function. And they concluded extracorporeal shockwaves are a safe therapy presenting more efficacy than corticosteroid injections. So speaking of corticosteroid injections, despite the research showing how bad these things are, they are still very common. What do I mean by despite the research showing how bad they are? Well, this large meta-analysis looked at the data from almost 50 different trials on steroid injections for plantar fasciitis, and they concluded corticosteroid injection is not more effective than placebo injection for reducing pain or improving function. Now, anytime you do a treatment, you have to sort of look at the risk-benefit, right? If there's no benefit, what are the risks? Well, corticosteroid injections can cause rupture of the plantar fascia, and maybe not immediately, but long-term, right? So how common is that? Well, despite most studies showing that plantar fascia ruptures due to steroids are underreported, again, because like I said, most ruptures happen after 6 months after the injection. This paper reported a rupture rate of 2.4% of people who got injections, and this paper found that the rupture rate was 5.7%. So a little more than 1 in 20 people get a plantar fascia rupture because of a corticosteroid injection, which we know has no benefit. So if there's no proven benefit over placebo and the risks are real, the math is pretty simple. I don't recommend it, right? So here's your action plan. Number 1, get the right diagnosis. Stop worrying about arch height. Manage the load and capacity. Certainly use orthotics for the short term if you want. It's probably not going to hurt. It costs you 50 or 60 bucks. Seriously consider shockwave therapy and forget about these other treatments, right? Corticosteroid injections, laser, PRP injections, things like that. The good news, with the right approach, most people can beat plantar heel pain. And as far as those fascias go on your patio plantar, I can't help you with regime change. But maybe if you follow the instructions on this video, you'll feel less heel pain while you plan your coup. Take care.